It's just a huge honor for me today to be podcast interviewing Patrick Kircher, an experienced CEO who partners with dental professionals, salespeople, and executives to maximize the potential of every business and client. After spending more than a decade working in sales, marketing, business development, management, Kircher truly knows what drives the dental business and its professionals. A coach at heart, having been involved in college baseball and professional scouting, has continued his passion for helping people maximize the opportunity at hand. The practice of building lasting relationships that ultimately change patients' lives through practices and products has always been the goal. He has spent the last 6 years developing his own dental service organization, having hands-on experience across several specialties, has provided experience in what it takes to own and operate a dental business. This experience has given him a truly unique perspective in almost every aspect of the dental business that is quite uncommon. Kircher recently took the opportunity to sell his business to an investment-backed practice management company to become the owner of TruDenta. TruDenta, he holds a BA from Lyon College as well as a Master of Science from the University of Central Arkansas. And you are right now in Little Rock, Arkansas. My sister lives in Fort Smith. When I was a little kid, I grew up in Wichita, Kansas, where it was the Arkansas River, and then you go down and you guys mispronounce it as the Arkansas River. But my dad used to take me down where the Arkansas River, we'd follow it down Kansas, about a 6-hour drive, where it met the White River, and oh my God, that was the best fishing trips. That's the most beautiful country in the world. Is that where you were born and raised?
No, sir, North Texas, but I've been here for quite a while, and you're right. It's some of the prettiest spots in the U.S. for sure.
Well, what's more beautiful, North Texas or Arkansas?
Not even close. There's not a whole lot in North Texas. You know that.
There's only two. The two most beautiful states don't get any attention. Everybody talks about all these other beautiful travel states, and it's really North Carolina and Arkansas.
It's a little secret. We'll keep it that way, I guess.
It is a huge secret. I mean, it is just huge. It is the most gorgeous area. So let's talk about first your experience with your DSO. You were in the DSO space.
Yes. So a long time. I was an early Invisalign guy, so kind of traveled the country there in the early days, and then started researching. Kind of fell in love with the dental business, and then started consulting. And then I wondered if I really knew what I thought I knew. So I figured. Time to put your money where your mouth is, I guess, a little bit. So I went out and acquired a group of practices and lived and learned, bought and sold everything that your dentists buy and sell. And boy, was it eye-opening from going from just your average sales guy to what it's like behind the curtain was eye-opening for sure. So had a great run at it, though. Enjoyed it. Learned a lot about the business for sure.
So when you said you started out in Invisalign, you meant as a patient or you were working for Invisalign?
Yeah, I was in early 2000s, so I was there earlier days. So when we didn't have near what they have now, and had a great run and stock at $5.27. So if you follow that, it's a pretty good little run there for a while.
What's it at now?
3 and change, I believe.
I've been trying to get the CEO of that show on my show. Do you have any relationship with him?
No, I've been gone for. Since after there was a change there, but
I have to say about Invisalign that in my 31 years as a dentist, when I started dentistry in '87, all the big brands of Colgate, Crest, Listerine, they're already made. Invisalign built the biggest brand in all of dentistry in my lifetime, and I've lectured in countries. I mean, Cambodia, Indonesia, Africa, all these. I mean, it's a global brand around the world. Kudos to those guys. And then the DSO. So what lessons did you learn from the DSO space?
Well, it's a lot harder to spend your own money than it is to take your advice and pop in and try to sell a product and move on down the road without really knowing what it's like to. I think I had 13 dentists and 42 employees at one time. So needless to say, I had a much better perspective as to the real world challenges of the dream that, when you pop in and you just see it all moving around, you think it happens pretty easily. But again, real good perspective on how difficult it really was and the pressures and where to spend your money when. And when you have to live with the repercussions of where you spend your money, obviously it shapes the way you look at things for sure.
Well, it's funny because when you mentioned Invisalign, the first thing you mentioned was when you got in 2000, your stock was $5. Now it's 300. I think the biggest red flag in the DSO market is not one of them is publicly traded. I mean, if it was a profitable business where you could go on Shark Tank and say, "Hey, Mr. Cuban, give me $1 million. I'm going to buy a dental office, and in a year it'll turn into two, and another year it'll turn into four, then eight, and six." They'd all be publicly traded.
I would tell you that there is it's difficult, as you know. Yes, I mean, I just had my own kind of mom and pop shop, if you will. It still was pretty successful and very rewarding. But yeah, I think you're onto something there. I believe it's not quite as easy as it appears, for sure.
Well, I love your hustle. I mean, when I look at you, I mean, you've been an athlete. I mean, your hustle. I mean, the dentists that really, really hustle, they all own their own practice. The ones who don't want to hustle, they all want to be your employee. I mean, Sandy Pardue is one of the most outstanding practice management consultants in the world. She says every time she's lecturing, the owner of the practice, front row taking notes, and all the associates are back there on their iPhone surfing Facebook and Instagram and Snapchat, and it's just. Do you think a DSO is easy money?
No, sir.
Do you think they'll ever be publicly traded?
Not a whiz on the high finance world, but you've got to think with all the money that's changed hands, that I would really think that there would already be some mobilization towards that area, and there does not appear to be some.
So when you're listening to me, I know everyone listening to my podcast is a millennial because I know the baby boomers aren't technically savvy enough to figure out how to download a podcast. So they're all listening to this old guy. Just remember, young millennial who just got out of dental school at 25. When I was your age, Orthodontic Centers of America was publicly traded on the New York Stock Exchange. There's a dozen on NASDAQ. They all imploded, and Wall Street doesn't ever want to see them again. When you go from one office to another office, that other office is a lot of money, and then you have to hire a dentist, and the product is a dentist. Is this dentist going to sell the invisible and convince Patrick that he has 4 cavities? And then after he sells it, which dentists will even tell you they're not salesmen, then when he leans you back, is he not going to hurt you? And then is he going to do the work so that after the work it feels good, looks good? It's so difficult to do. And you really need owner-operated stores for any type of efficiency. And when you sit there and take the people and say, I really don't want to hustle. I don't really want to have any skin in the game. I kind of just want a job. Well, the high cost of dentistry employed by a bunch of people who just want a job, it's not an easy game.
No, sir. No.
Yeah,
a lot easier ways to make money.
Oh, yeah. There's a lot of, in fact, I tell people, if you want, here, I'll just say right here, you're in Invisalign. If you told me that you wanted to buy $1 million investment in DSO, I'd say, well, why wouldn't you just put the money in Invisalign? I mean, I'd just buy the stock of Invisalign. Then when you want to sell your Invisalign, you could sell it in 1 minute. Go try to unload a $1 million dental office. They're not liquid assets. And a lot of people who think Invisalign is, what's the future of Invisalign? I'll give you another old man grandpa perspective. When I was little, big Catholic families in Wichita, Kansas, 6, 7 kids was the norm. Only the ugliest girl got braces. And it was a huge investment. Now the big families have been replaced with 2 kids. Everybody can afford braces. And now you see 40-year-old women coming in, ready to drop $6,000 on Invisalign because they want this to slightly change and this one slightly. So ortho has gone from, you got to fix this girl up or she's going to have to be a nun. No one's going to marry this girl. To now, it's just so people are going to have braces when they're in their teens and their 30s and their 50s, bleaching, bonding, veneers, and braces. There's 8 billion people on the planet. Half of them are women, and they're all going to want it 2 or 3 times during their life. So Invisalign stock would be a hell of a lot easier money than doing a DSO with a bunch of employees who don't want any skin in the game. So now we'll get to what made you buy TruDenta?
Well, so I sold my business, and I guess as you said, as a hustler or one that tries to be, is I guess I had about 6 months where I was contemplating what was next, and I've been involved in every aspect of it. So this opportunity crossed my desk, and I kind of knew a little bit about it, but like many people, didn't quite fully understand what TruDenta was or was not. And quite honestly, one of the goals I hope today is that we're able to maybe open that up a little bit more and dig into what it is and what it isn't. But, I kind of know where, having been involved in the corporate side, of where people want to go, what the modern day dentist is looking for. And I saw a real opportunity for myself to take TruDenta, as it were, put in a couple spots, which I think are opportunities, maybe even missing pieces, and then roll out a plan that was, a company that a dentist could partner with and start making a little bit more money with what they know and not what they do. So obviously that's a goal. Being a former on the business end of things, was how do we produce more without moving the handpiece and tying up the doctor's time. So, at the heart of it, we get a chance to help a ton of people. And that's really where I think between those two, I really thought I was onto something. And I've taken it and run with it since December of 17. So still fairly new.
Well, you have the one video that I really, really liked. Oh my gosh, I just closed it down. What an idiot. My big fat sausage thumb hit the wrong button. Yeah, this video, I think we should I think we should play now. First of all, like, what is it? And you have this where was it on your screen? I'm looking on your watch.
Was it the whiteboard video you talked
Yeah,
about?
the whiteboard video.
Yeah, it's on DRS Doctor, about half the way down, and it's
Half the way down.
Yeah, TruDenta Explained, I believe. Is that the one you're looking for?
Yeah. Read more business partners, concepts, libraries, latest blog. So it'd be under DMSD Explained.
No, it should be TruDenta Explained. You're talking about the white video where they draw it out?
Yeah. Well,
Yeah.
anyway, is it on YouTube?
It is, yes, sir.
Can
And
you email that, and then we'll insert that right now, because how long is that video?
It's about 3 or 4 minutes.
Yeah, it was a well done video. I mean, I wanted to get you on the show after I watched that video. I thought that just explains it all.
Life has been rough for John and Becky. For the past few years, they were both suffering from something they didn't even know they had. Every night when they went to sleep, John snored, loud, which was tough for Becky. John also woke up feeling tired and unrested and had difficulty sleeping through the night, as did Becky due to the snoring. As they went on with their day, Becky often felt pain in her jaw and neck and had migraines on a regular basis. She thought this was due to her stressful job. It wasn't until Joe, a close friend of John and Becky, mentioned that they should talk to their doctor. After seeing a number of specialists and booking plenty of appointments, John and Becky still didn't find the answer. They felt defeated, not to mention still in pain. Things took a turn for the better once they found drgregpile.com. However, it was a dentist. John booked an appointment anyways. Dr. Greg Pyle warmly invited them in and talked with them one-on-one. They soon learned that John suffered from sleep apnea, and Dr. Pyle could help. Becky also found that Dr. Pyle could give her the headache relief she was looking for through a pain relief system called TruDenta. John and Becky were thrilled. Never before did John or Becky think their dentist could be the one to help them. Dr. Greg Pyle and his team have provided sleep apnea and headache relief to hundreds of patients. Your dentist can fix more than just your cavity. Whether you're suffering from sleep apnea, TMJ, or you're simply ready for the perfect smile you deserve, Dr. Pyle and the team at University Avenue Dental have the knowledge and the ability to give you your life back. For more information, or to schedule your appointment, go to drgregpile.com. Are you ready to start smiling again?
So now they watched that video. I really like that video. Talk about that video and tell me what's got you motivated in this.
Yeah, so at the heart of it, we know that unexplained pain, mild to moderate TMD disorders. There's just so much that I even witnessed firsthand of people coming in with a myriad of issues and really not being able to trace it back to one specific thing or one specific bucket or category that it can be in. But at the end of the day, a lot of this is what the kind of the basis of the DMSD, which is dentomandibular sensory motor dysfunction, which is a long word, fancy for imbalanced and improper forces in the mouth, which leads to just a myriad of dysfunction. And the cool thing about it is about 1/3 of these are actually dental related and force related in the mouth. So the original TruDenta, as it were, was just simply a marriage between occlusal-based dentistry and physical therapy of the head, neck, and face. And so, at the heart of it, that's what we do is we look to see if someone does have imbalanced or improper forces, put them through a protocol, and just amazing how many of these people get better who've been everywhere and tried everything. It's really enlightening. And the cool part about it, Howard, is that the dentist is the only one that can help these people.
Well, I love you said DMSD, dentomandibular sensory motor dysfunction.
Yes, sir.
And if anybody should talk about dysfunction, it should be me. I should be the poster child of dental dysfunction. If it's dysfunctional, DMSD. So how long has dentomandibular sensory motor dysfunction been around? And what's confusing about TMJ is the people know it by TMD. Right. And the dentist always say, it's not TMJ. No, it's not TMJ. They know by TMJ. They said, they say, well, it's temporomandibular disorder. You're just talking about an anatomical joint. Well, the people call it a root canal, and the dentists want to call it endodontics, and the patients want to call it braces, and everybody. So what matters is that you can communicate with your patients, and they call it TMJ, root canal, braces, not TMD. And what's DMSD in your mind? Dentomandibular sensory motor dysfunction. How is it different than TMD? And talk about that.
Yeah, I'm with you. So TMD, J, however you want to term it, is really just a really small piece. And honestly, I think it's probably one of the biggest misunderstandings is that that's kind of what we do. And it's really just a small part of it. Honestly, as the program was until I bought the company, was more headache based and migraine based. And so, at the heart of it is the theory behind DMSD is that if you have improper balances, improper forces in the mouth, basically it wreaks havoc and causes dysfunction of the head, neck, and face. And so for us, we don't really distinguish between, everyone's symptoms could be different. So it could be mild to moderate dysfunction in a joint for you, and it could surface as headaches for the other. But at the end of the day, those improper and those signals are sent to, to the base in the trigeminal there, and they radiate head, neck, and face. And quite honestly, no one else addresses those factors. And most importantly, most people either will treat with a mouthpiece or permanent orthotic or something to the effect, and never really get to the heart of it, which is the actual removing the occlusal issues, but also more importantly, the rehab of the head, neck, and face. We would never do that with a joint, any other joint other than the TMD, right? I mean TMJ. So it's a really neat, comprehensive turnkey program for you to treat a myriad of symptoms that are all force based.
And I see on your website this beautiful, handsome, bald man, Mark Montgomery from Salem, Oregon. He was involved with this too, or initially, or?
Yes, sir. So, at the heart of it, when the company has been around for 10 or 12 years, Mark was integral in coming up with some of the finer points on the clinical. Did an outstanding job for years, and we owe a lot of it to him and his research, and he's done a great job for sure.
So how do you make money on the deal? I mean, what's the business? Are they buying education, machinery, equipment, services? How is it a business for you?
Yeah, so TruDenta, as it were, was just that model that I described to you. As I got into it, I knew the opportunity and around sleep was huge, right? Obviously, it's a buzz and sleep disorders. And when I started research the things that TruDenta treats, I saw that most people, depending on, it was a very high number, between 70 and 90, I hear most of the time, of if they have a sleep disorder, they also suffer from the issues that TruDenta treats. So it made sense for me I know how dentists like to have things kind of packaged and turnkey. So we started doing a lot of research and kind of coupled in sleep with the TruDenta, as it were. So in essence, in TruDenta 2.0, we were actually able to kind of do a turnkey package to where the dentist could partner with one company and treat everything under one umbrella that medically necessary dentistry is kind of the tagline that I've tried to go with, to where anything in the space that you're looking to treat, migraine, headache, TMD, sleep medicine, sleep disorder, all that within one system there. So we actually do sell a system included with training and equipment that allows dentists to treat in office and render these services. And then last but not least, we've actually partnered with a medical specialty network, which is maybe a show in and of itself, but we actually have some great results, unlike the billing companies that are in the dental space right now, to where we're actually partnering and getting great in-network reimbursement.
You also have on your website webinars on demand. How many webinars are on demand there?
Yes, sir. It's been a little bit since I've visited that one, but I do know that there are 7 to 8 webinars, I believe, that are on that dsdoctor.com site.
Yeah, you ought to. Another person is on your website is the famous Dr. Ron Ritzko, prosthodontist in Houston, Texas. Is he still involved with your company?
No, sir. I think at one time he was a key opinion leader or something. I'm not exactly sure. I did reach out to him when I started, but I did not have any. He's no longer involved in the company. No, sir.
Yeah. So how could they learn more now? Would you have them go to the webinar on demand, or what would be the next step for someone listening?
Yeah, so we have the drsdoctor.com site. We have tons of information up on our commercial site as well, TruDenta.com. And most importantly, we have the webinars such as, the podcast now. We have new online marketing materials, and we have just a lot of really good resources there on that drsdoctor.com. It has a lot of educational pieces and webinars and white papers.
So what are they actually buying? A marketing program, a training program? Is there equipment involved?
There is. There's 5 different pieces of equipment that are used to diagnose and treat. You are getting an in-office training, which is, one of the big things I think that coming from my side of things, from the implementation side, from a dental practice, is how do we get folks in? How do we get you trained in your office? I think in the past they were doing big seminars, and I know it's a chore to get people out because I knew it was a chore for me to get 10 people to fly to Las Vegas or to Fort Lauderdale to get trained. So we're offering in-office training, which I think has really done a great job for the implementation side of things. And, basically it's a turnkey package where we allow you to diagnose, treat, and then gain medical reimbursement for all things medically necessary that a dentist would like to provide. And wildly effective too, because we only treat those people that we know we can help.
So these are the 5 pieces of equipment on your website right there?
Yes, sir, please. Well, most of them, yes. I don't see all of them, but yes.
Well, you want to go through each one of those and what they do and how much does this system cost?
Yeah, so right now the system has been at $79,000. That's been the same price for I think 7 or 8 years now. A couple things that we have been able to do is we have great financing partners, and if you're speaking in terms of ROI, most of our doctors are in under $1,000 to $1,500 a month, and we're seeing about $5,000 a case for a TruDenta case through our medical network. So, having been involved and bought everything in a dental office, that is a great ROI. There's no doubt about it. But the only flip side of that is you're talking about educational and integration is, if you've ever tried to do anything medical, as you well know, it's not an easy task. That's for sure.
So who's your key dentist instructor, or who's your?
Yeah. So what we've done really is we've taken the successful platform that we've had, and the great thing about this is kind of where I differ from probably my days at Invisalign, is we have a ton of raving fans, for lack of a better word. We have source docs and doctors who have practical hands-on experience of 10 plus years that are a phone call away. We have a myriad of 10 plus on the ortho side, 10 plus on the GP side of guys that are willing to take calls and give real world feedback. So we have the foundation. We really haven't, in my mind, with the system is baked. We don't need a chief dental officer, a chief dental person driving it. We're doing more of the grassroots, and quite honestly, we've got all the information that we need, and we've got a wealth of doctors that are willing to talk to people and give them real world experience for sure.
It is amazing. When I got out of school 31 years ago, no one was talking about sleep. I mean, sleep has just exploded. And I always tell dentists, I'm sure when it comes to everything Einstein knows, I'm sure at the universe level, mankind doesn't even know 1% of the knowledge. I'm sure as far as all the knowledge about Earth, we're probably at 5% levels. I'm sure when it comes to TMJ, sleep, I mean, to me, it's obvious that it's very multifactorial. It's going to be a long time before we understand a lot of this stuff. I mean, imagine if we were living 1,000 years ago when Genghis Khan was. I mean, you wouldn't know anything about dentistry. Go back 2,000 years or 2,500 years with the Greeks. I mean, so I'm sure there's so much that 1,000 years from now, this is going to look very different. But what I liked about your analogy, what I liked about TruDenta was instead of saying, oh, we know everything and here's the cure, it's like you were making the sports analogy. Like in the sports analogy, they don't give you pain pills and tell you to go home. They try to use therapy. And I obviously, when it comes to sleep and TMJ, there's all kinds of different camps. They all don't agree on everything, which only makes me realize they don't know everything yet. And it would be a lot more fun to practice dentistry 1,000 years from now or 10,000 years ago when we know everything. But we're so far from that. But I want to give one analogy that I've lived through. A long time ago, a senator just passed away, Senator John McCain in Arizona, where I'm here. And I remember someone asking him, he was a very upset orthopedic surgeon when Congress started covering chiropractors. And he said, look, he says, when you guys cover it, it's $50,000. When the chiropractors cover it, it's $500 to $1,500. And 5 years later, both of your patients are still having problems and pain. So the deal is, are you treating this faster, easier, higher quality, lower cost, more miniature? I see a shift that 30 years ago, everybody's going to the surgeon, everybody's getting filleted open, they were getting their backs fused, they were getting all this stuff. And then everybody lived through like, wow, that was invasive and it really didn't work. And now I see this whole shift to more holistic, more therapy. Can we do this without drugs? Can we do this without pain pills, pharmacology? Would you say that yours is more of a conservative approach to TMD, sleep, all these stuff, as opposed to when I got out of school and they were still doing, my oral surgeon friends were doing 2 or 3 TMJ surgeries a week. You never see that anymore. So is it more conservative?
Yeah, I think you're right onto it there. I try to say that I'm philosophy neutral because, as you know, in TMD or sleep or whatever camp, like you said, the camps are so polarizing and one doesn't like the other and vice versa. So what I love about what we've created is the ability to not, for you to treat how you have treated and to the philosophy that you agree with most. But I'm with you is, the ability to go in and just treat it kind of neutral and not be subscribed to any one particular item. But yes, TruDenta 2.0 plays right into modern medicine, I think, as far as people not wanting, one of our taglines is no pills, no shots, no permanent orthotic, right? So it is absolutely right in line with where I think not only the medical world's going, but certainly the dental world. And you think about it, this is what makes sense to me completely is, if you hurt your knee on a ski slope, they wouldn't put you in a brace and tell you that you're going to be better as long as you wear this for the rest of your life. There'll be, without any surgery or any rehab of any kind. And honestly, that's where we are in the state of dentistry for many things is we never really try to get to the root of the problem. And, the kind of the thing that we go along with is about 1/3 of these people that suffer from issues that have been to every neurologist and TMJ people all over the country really comes down to the fact that they have a force issue that they've not been able to take care of and have never rehabbed the soft tissue or even began to look at that angle. And I think that's a really one of the untold stories for sure.
But when you get older like me and you've been in dentistry for 3 decades and now you have, 5 grandchildren and you think, how would I want my little grandchildren to be treated? And I wouldn't want them to have TMJ surgery. I wouldn't want them to have these aggressive things. I wouldn't want them to have to wear an orthotic the rest of their life. And the older dentists, they don't realize when there's threads on Dental Town. You just say holistic and most of them hit the roof, especially the older ones. But again, the guys hitting their head on the roof and hate holistic, they call it endodontic therapy. The patient calls it root canals. They call it TMD or DMSD. The patient calls it TMJ, sleep. So they're attracted to holistic because when the consumer market sees holistic, they don't like the medical model. They don't want to go to a doctor who says you're either going to take a prescription or have a surgery. And that hasn't changed since the medicine man model of 15,000 years recorded history, where every tribe had a medicine man and he'd make some lotions and potions out of herbs and spices or pull out a knife and cut something off. And that model really hasn't changed until just about now. And what's so funny is how actions don't equal words. These dentists, my age, hate holistic medicine. But my God, the minute they get high blood pressure, do you think they want to take a pill every day the rest of their life? Or do they finally join a gym, lose 50 pounds, start holistically treating it? And I always sit there and say, man, it sounds like you're starting to get holistic the way you're eating more fruits and vegetables and not eating pots and pizza. And you switch from Jack Daniels to bottled water and you're walking. And doesn't that sound like, are you a hippie now? Are you, you sound like one of these hippie holistic guys, but man, when you sit there and advertise on your website, holistic, no pills, no shots, no orthotics, and you're trying to do more non-invasive, holistic, whole body stuff, because there's a lot of stuff in that stuff too. I mean, it's got to be lifestyle. I mean, how do you sleep well at night if your kids are doing something insane? You're going through a divorce. There's stress. There's physical that you talked about. There's your teeth. There's so much involved in that. And if we understood it 100%, then we wouldn't see all these TMJ camps. They would all go to Wikipedia and say, this is the answer. So we're not there. And that's going to be another century or millennium away. So while my granddaughter's in your office today, when you're operating under, you know what you know, but you don't know what you don't know, patients want conservative treatment. And the other thing I liked about your video is a lot of dentists say, well, I don't want to have a TMD practice or a TMJ practice, whatever, but that TMJ practice, she's going to be married to a spouse. She's going to have kids. She's going to need fillings, cleanings, and they don't understand the ancillary business. Someone comes into you for no pills, no shots, and now you got a family and you're doing family practice.
Right. And think about this, Howard. Think about the way that, like, just force in general, even not being a non-professional, so to speak, looking in mouths, although I've looked in many over my years. But force is such a prevailing factor, even for myself. The great thing about TruDenta is it's not necessarily just your full-blown migraine patient. There's a lot of people that I'll give just my own testimony, I guess, is all my restorations are on one side. So the decay all just go to one side. I've broken the same crown 3 times. I have large tori, grind. So, these are things that are never, even in the dental profession, no one ever really connected the dots for me. So for the dentist or the dental professional that's out there thinking, well, I don't want the TMD practice, or I don't want the headache, or all the people that come with it. Man, you look in the patient's mouth and how often there are dysfunctional forces in the mouth and how they wreak havoc not only on the dentition, but as you do a little bit of research in this space, which I'm sure most of them have, you see how interconnected everything of the head, neck, face is. And I think the opportunity to treat and help people, and really how conservatively about 25% to a third of these people who have headaches, migraines, mild to moderate TMD are all predicated on that improper and imbalanced force. And you take care of that, you have a chance to really get to the root cause of the problem, like you said, instead of chasing it around with Band-Aids or orthotics or what may be, shots, teeth, Botox.
And how long have you owned the company?
So I've had it since December in full. So it's been about a year and a half. I was a managing partner early on, and now I've had it all to myself for about since December 17. So had a lot of success, and there's 600 systems in U.S. and Canada. We've been able to kind of add the sleep and the reimbursement piece, and now we're getting really good results, and the business is growing very nicely.
Now, just to review, these are not advertisements. These are not commercials. You didn't give me money to be on the show. I have no financial connection to him. He doesn't advertise, nothing like that. But I tell dentists all the time that if there wasn't about 500 dental companies, we wouldn't look like we were Star Wars with the Jedi Knights and all that stuff like that. I mean, if I didn't have MRIs and all the stuff I do. So I love getting dental companies on there. And when dentists say to me, well, why did you have a guy that owned a company? He was trying to sell something. It's like, shut up, dude. Are you a volunteer? Are you a volunteer dentist? You do free dentistry on the homeless? Oh, you have a dental office and you sell crowns and root canals. So you're holier than thou. But anybody who sells you stuff to help you do a root canal and a crown is a salesperson. So, it's just elementary tribal judgmentalism. All tribes have their own leaders, their own customs, their own cultures, and they all think they're holier than the next tribe down the block. So, I love the fact that I mean, you spend your whole time in dentistry, you spend your career in dentistry, you buy your company in dentistry. I'm your biggest fan. So of your 600 customers, what's the chance? You know what I would, you know what I think your best marketing would do?
Love it.
On Dental Town, we've had 5 programmers. We'll be 20 years old on St. Patrick's Day next March 17th. I'm Irish. I got ready to launch. We launched it on St. Patrick's Day. And we have that 500,000 lines of code and all that can be in a message board forum group. And you can have your own private group. So when you have a private group, you'll be the one that lets people in or out or whatever. You can control the deal. But the people, it's the fastest growing part of Dental Town because it's free. Whoever sets up the private group, you're in charge of it. Like if I wanted to join, you said no, or someone was, because you always have about, I would say, I don't know, it's only about 1 out of 1,000, but 1 out of 1,000 people are trolls and negative, and they're just miserable in their life, and so they want to drag everyone down their toxic hole. But what'll happen is if you got 250,000 people in Dental Town and they see this TruDenta private forum, or just getting them to post cases. But out of 600, I would say about 1% of dentists are super user social medias. You gotta get them to start a thread on Dental Town and start posting cases on this.
Yeah, and that's really one of the things that I really appreciate about the opportunity, because I think there is a lot of misunderstanding, misinformation, and 2 of the biggest challenges I think TruDenta has had over the years, which was implementation and reimbursement on how to sell it and how to position it, something that's not bread and butter dentistry, has been the challenge. And that's why I would love a chance to add a new narrative there, and having the success and the people who have implemented well and have started to integrate sleep and co-diagnosis of sleep in the TruDenta protocols. We're seeing 5,000 to 7,000 in direct in-network medical reimbursement, which has never happened before. So I really love the idea of how do we reinvent the story, for sure.
Well, I just went to Dental Town, and we have a search bar, and I want you to use that search bar because that damn thing cost me $50,000 from Google, and it's a box. So anytime I want to upgrade, it's not a software upgrade. I got to buy a new box, and so about every 4 or 5 years, when I want to improve the search algorithms, I buy another $50,000. But I just typed in TruDental, and the first there's lots of threads on it. The first one is by Jim Boyd. Do you remember Jim Boyd?
No, sir, I don't.
I am podcasting the owner of Dental right now. I am podcasting. So Patrick is such an Irish name. Are you Irish?
I believe I'm a little bit all the above. A German last name and Irish first name.
That's the first sign that you're truly Irish is when you're a Heinz 57. But I don't think there's anything, including farm animals, the Irish didn't sleep with. Kirche. Who is the owner of TruDental? TruDenta.
Yes.
Do you have any questions for him? Well, here's what I know about Dental Town. People don't like buying through faceless organizations. Like, when they were diehard Apple fans because they knew Steve Jobs. They're diehard Tesla fans because they know Elon Musk and they see him smoking pot with Joe Rogan and right now on the deal. And so they and the reason they hate the government is because the reason they hate the IRS in the post office because they don't associate someone like your face and your message and your brand or whatever. And the best way you talked about, you'd like to take back the narrative and you'd like to control the narrative, is for you to get on there and tell them, this is me. I'm Patrick. I'm the owner of TruDenta. Talk to me. We listen. We're transparent. And then to go back and get your 600 people using your system to try to join you.
Engage, for sure.
And what's great about Dental Town is we have a report abuse button. So if someone's out of line, you hit report abuse, and we have a dozen dentists who get the email who are not paid, who are dentists, who are real world doctors of dental surgery to judge, was this a constructive critique or was this over the top? And I think that one of the most misunderstood things in the world is freedom of speech. Everybody that ever says freedom of speech is usually a complete idiot because I've never seen it used correctly. The freedom of speech is something that the Constitution defines between you and your government. You know, you have freedom of speech to your government, but you walk into my house in Phoenix, Arizona, and start screaming at me, I have the right to shoot you. And Dentaltown is private property. And when you're on Dentaltown, gentlemen can disagree, but talk constructively, talk fun, talk like you were at a party and you guys were having an hors d'oeuvre together as gentlemen. But when you come in there and you start toxically throwing flames, I mean, we're going through this in the public right now because some of the bigger social media sites have thrown off like Alex Jones and things like that. And people are saying, oh, they're taking away his free speech. I'm pretty sure Twitter isn't a volunteer corporation. Either is Pinterest, Instagram, Facebook. And if you're coming on there saying a bunch of hateful stuff, free enterprise has the right to throw you off. Now, if you want to go stand in front of the White House with a sign, you do have the right to go do that. But you stand in front of my house with a sign and you're going to see a 12-gauge shotgun.
Yeah.
So I would take back the narrative. And
Yeah.
when your logo is your face and they see that TruDenta is actually a person and they see it's Patrick Kircher and then you get your other friends to come on there. And when I want to promote more discussion of TMD because too many people that teach it always act like they know everything. And it's like they know anything. How come there's all these patients who still have this problem their whole life? So when someone says, oh, I know exactly what cures migraines. Okay, well, here's 1,000 ladies who are still suffering from migraines. If you knew everything about migraines, why are they still suffering? And they say, oh, it's this, it's that, it's chocolate. Look, we're trying to help patients get through life at a time when we might, I mean, what percent of all the dental knowledge do you think is known in 2018 versus what will be known 1,000 years from now? Where do you think we're at? I mean, do you think we're even at the 80-20 rule?
No, I don't. No, I'm sure we're not. No.
Yeah, and then when it comes to the universe, I mean, when these people say, oh, the universe is exactly 14.6 billion years, I'm like, if you even believe that, you're dumber than a rock. I mean, for all you know, we're one of 1,000 universes. For all you know, this Big Bang blows up, contracts. For all you know, there's a million, trillion, infinite other ones. Just like, I mean, you don't know anything. You're a talking monkey stuck on a rock that's stuck in an orbit around a star. And you've never had a monkey step foot on another planet, leave the solar system, let alone the galaxy, yet you know it all. You know it all. That's the definition of a
I
human.
wasn't sure what to prepare for, but I didn't know we were gonna go monkey and other universes. That was pretty deep. I enjoyed
Well,
it.
it is deep because these TMJ guys, these young kids. I mean, I'm trying to share what I learned
Right.
after 3 decades of this with these
Right.
kids. A lot of when people email me Howard@dentaltown.com and tell me who you are, a quarter of them are in dental school, and all the rest are under 30. And I only get 1 email a week by somebody who's as old as senile as me. And these young kids come out of dental school and they're humble, and then they go to this lecture, and it's some old guy with white hair who's just sitting there breathing like a fire and brimstone preacher, just claiming he knows everything. And I'm telling you, they don't. They don't know everything.
And that's a great point. So yeah, I'm with you. Is that, you talking about taking back the narrative and what we do and don't know is, I know that even before me and now we get great results, and that's never been the issue. The issue is implementation and reimbursement, which it is for everyone who's probably on this forum. That's what you're looking for. That's what everyone has trouble with. And the fact that I've been involved in the dental business, there is no doubt that is the challenge. And so that's the 2 areas that we tried to attack head on. And I think we've made some great strides there. But do I think one thing fixes everyone and the cure for cancer? I certainly don't. But I do think that a lot of these things have very, very similar causes. And the one that we can control is the improper and imbalanced forces in the mouth and what the negative that can fall out from that. So it's remarkably effective with our protocols for sure.
So the bottom line is you have 600 dentists in the United States and Canada using your system today.
That's how many have been sold, yes, sir.
And how many of them do you think are still using it? Versus
And being the new business owner, I would be, I've done my best to reconnect with as many users as possible. It's just, I really honestly have no way of knowing that, but I think that based on the layout and the reimbursement, I think the 80-20 rule probably would be in effect here as well, just like it would be for CEREC or anybody else, So, but I'm not one to run from that. I actually know what it's like and how hard it is. And that's why I've made great strides to try to break down some of those barriers and being able to treat more people with one system and more, production per patient or problems per patient, however you want to look at it, is certainly a way to do that and to make it more simple for the end user. And ultimately, Howard, I think you know this, is that selling anything that's outside of the norm for cash is a task. There's no doubt about it. So be able to partner with people on the medical insurance side is game changing, quite honestly. And so, I think anyone who says they have medical insurance also figured out is also probably, one of those things you should be careful of. But I think we got a really good program, and we're working hard to evolve and stay on top of it. So.
Well, here's what I would do. Here's my marketing advice to you. You're a dental company owner. I'm a dentist. Here's what I would do is go back to social media studies. And it doesn't matter. We're talking about all the social media platforms, Facebook, Instagram, anything social media. It's very common that only 1 out of 100 are what they call super users. And 9% engage, which means we'll comment, LOL, ask a question, whatever. 90% lurk. And it doesn't matter what social media format you're on. Because since we're social animals, since they're so obsessed with how they fit in their tribe, with how their clothes and how they look and their appearance and all these social stuff, 90% just they want to be invisible. Only 1 out of 100 doesn't care what everyone thinks. And so there must be something wrong with the super user, because they're going to talk, and if someone disagrees, whatever, they are totally comfortable flying above the radar. So since this falls under TMD sleep, TMD, Dentaltown has 50 categories. And the bottom one, the last one, is at the very bottom, because it starts with T, is TMD and occlusion, sleep apnea, snoring, and appliance therapy. So if you clicked into those, you would see that under TMD, that all these, who made the courses, which dentists are the ones posters, and what a lot of companies do is they try to network with super users. They try to isolate, like Instagram. Like if I was selling Chanel No. 5, I'd want to find the Instagram chick who everybody follows on how to smell better. I personally use 2 different deodorants, a different one under each arm, but that's just my 2 cents. SENTS. But what it is 3M, Ultradent, Pulp Dent. What they'll do is they'll look on Dentaltown. They'll say, okay, these are. I think Dan Fisher and 3M and Pulp Dent are some of the smartest companies on. They'll say, okay, these guys, these 5-10 guys, either everyone's asking them the questions, or they're posting all the cases, or they're doing all the online courses. So you should reach out and contact the people doing all the posting in TMD. So what you'll get, if they don't like your company, you'll find out why. If any of it's fixable, you'll see if any of it's worth fixing. And then if you find a product champion, then you can work with them and say, would you post cases or this or that, or be your spearheader? And I think the Fortune 500 does it much better on like Instagram. I think Instagram is where the companies go out and find who's the chick that everybody's following on makeup or clothes or this or that. And sometimes people will just email Howard Goldstein. I'm Howard at dentaltown.com. The other Howard is Howard Goldstein, so he's Hogo at dentaltown.com. And I see emails all the time to say, who are the chief influencers on, say, endodontics? And they'll say, well, here's the 10 guys that just can never go a day without talking about root canals. And then the company will say, well, I want to see what this guy thinks about this new file or this new deal. And if you get a 1% super user who feels naturally flying above the radar to be your product champion, and there's no financial connection, and so people can trust him, and they say, this guy just loves our product and he's always talking about it. That's the best marketing you can do on Instagram, selling makeup and shoes. That's what I would recommend.
I appreciate it. Yeah. So, I like to say I'm a big boy, and I love tackling challenges and where the baby was ugly and what needs to be improved. And I've tried to tackle all those things heads up and heads on, and just trying to make the company better and make the product better. And, at the end of the day, we get phenomenal results and we help tons of people. It's just the implementation in a dental practice is a challenging one, as we all have been there and all have lived and learned, for sure.
You were born and raised in Texas. Are you familiar with Mac Lee?
Mac Lee. I don't guess so.
Oh my God, Mac Lee's like the biggest name in TMJ, TMD. Everybody, he's in where is he out in Texas? It's a really small town. Of course, Texas.
In all transparency, any specific philosophy or instructor in my career has been something that I have not. How you expressed it earlier was how I treated it. I didn't want to be. Selling is difficult, and knowing who the players are, it obviously makes sense. But then getting into specific philosophies and discussions about those and who's right. You're talking about religion, politics, and whose philosophy is correct on TMJ would probably get you kicked out of a bunch of
I
offices.
love Mac's quote. People do not buy what they don't understand, nor do they buy solutions to problems they don't perceive to have. I mean, he's just a great guy. He's in I would start with have you ever heard of Bastrop, Texas?
Yes, sir.
Really?
Yeah.
Oh no, Mac's in Edna, Texas.
Edna?
Edna, can my homies email you?
Absolutely.
Okay, so what is your email?
Kircher, P-K-I-R.
Wait, let me see if I got over here. Okay, so P-K-I-R
C-H-E-R.
C-H-E-R
at TruDenta.com.
TruDenta, TruDenta.com. Okay, P. Kircher at TruDenta.com. And Mac Lee's going to shoot me when I won't give his email out over the deal. Of course, Mac wouldn't even care. He's drmaclee@gmail.com. Mac Lee, please meet Patrick.
Howard, you were mentioning something there, just like the addition of sleep. I think we're just touching the tip of the iceberg here on what is interconnected and what can be done, and treatment modalities and the medically necessary dentistry. I'm excited to take the platform that we've had and then try to see if we can help more people with it, and branch and morph and.
Well, you're from Arkansas. I just sent you an email, introduced you to Mac Lee, who's probably the most prolific TMJ poster on Dentaltown. And I think the next thing you need to do is talk to Mac Lee. And you bought this company to see what you got, what would be the best thing. And at the end of the day, what are 2 million dentists around the world trying to do? Help 8 billion humans get through life with this thing called oral health, and try to keep them more healthy, out of pain, more function. And I think that would be the next best step for you.
Yeah, and like I say, I welcome any and all comments, feedbacks from all parties, all walks of life. It only makes us better, and I'm a blank slate trying to learn what I have and where I can take it, and my experiences and those of others. So,
and if you want to go to Mac Lee, just go to Dentistry Uncensored. Type in if you go to Dentistry Uncensored, Mac Lee. I think I've podcasted him a couple of times. Yeah, he was number 572, neuromuscular principles. And there was Mac Lee.
Financial crisis, domestic crisis, etc. And what happens?
I'm going to send you that one too.
But that makes sense because what you just said, a stressful financial crisis, that'd be a man getting married.
So I just emailed you Mac Lee, so that when you call him up, you'll know what he looks like. But hey, congratulations on your 20 years in dentistry. I I have kindred spirits with anybody who buys a dental company. That's pretty damn cool that you chose our industry as opposed to any other industry. And thanks for coming on the show today and telling everybody why you bought this company and what it can do. And that 600 dentists have this system in the United States and Canada. And I hope to see you on the message boards. How far are you away from Edna, Texas?
I don't even know where Edna. I knew where Bastrop was, but I didn't know Edna. So.
Well, it's right next to that.
Oh, yeah. All right. So probably 6-7 hours, but nice little plane ride. No problem.
All right. Well, hey, thanks for spending 20 years in dentistry.
Yes, sir.
And tell Mac Lee I said hi, and I hope to see you on the message boards on dentaltown.com.
Yes, sir. Thank you so much for the opportunity.
All right, buddy. Have a great day.